Please subscribe and hit the bell icon so that you will never miss any video from Acuere Life Science Foundation. Myself, Dr. Shantanu R. Joshi, a clinician, a pharmacologist and a drug researcher. Dear students, today we are going to see the adrenergic receptors. They are principally divided into alpha receptors and beta receptors. You may have a question in the mind from where Dr. Joshi you bring this alpha and beta receptor, and that's why I would like to explain the details. All of you know, dear students, there is a chain of ganglion running parallel to the spinal cord. There are 31 ganglions running parallel to the spinal cord, and there are nerves arising out of it. The whole system is known as adrenergic nervous system or sympathetic nervous system. There are preganglionic fibers which secrete acetylcholine, which act on the postganglionic fiber, and the postganglionic fiber at the another end secretes noradrenaline. The preganglionic fiber may have supplied to the adrenal gland, it supplies to the adrenal gland, and adrenal glands also secretes noradrenaline and adrenaline. This noradrenaline and adrenaline act on the tissue through the receptors, and those receptors are alpha receptors and beta receptors. The alpha receptors are further divided into alpha 1 and alpha 2. Beta receptors are divided into beta 1, beta 2 and beta 3. Alpha 1 receptor again subdivided into alpha 1a, alpha 1b, alpha 1c, like that. But we would not like to go in detail of that. For the simplicity, we will consider alpha activity as alpha 1 activity and alpha 2 activity. Dear students, by the stimulation of alpha 1, peripheral vasoconstriction is observed. Due to the peripheral vasoconstriction, alpha 1 activity is responsible for rise in the TPR and rise in the systolic blood pressure as well as diastolic blood pressure. Alpha 1 activity is also concerned with inhibition of lipolysis. It stops or reduces the lipolysis. Ultimately, it will favor the deposition of fats. Alpha 1 activity favors the deposition of fat. It inhibits lipolysis. Alpha 1 activity is also concerned with glycogenolysis. Glycogenolysis means it converts the stored form of glucose, that is glycogen, into glucose. Thus, the BSL, that is the blood sugar level, will rise and more sugar will be available in the peripheral tissues. Alpha 1 activity is also concerned with the contraction of smooth muscles of urethra. When the smooth muscles of the urethra are constricted, there will be retention of the urine by alpha 1 activity. Alpha 1 activity is also concerned with dilation of the pupil. We call it mydriasis. The mydriasis is an effect of alpha 1 stimulation, and alpha 1 is also responsible for inhibition of renin secretion. When it inhibits the renin secretion, the RAS system, renin, angiotensin, aldosterone system, is depressed, and it will ultimately result into reduction in the blood pressure. Now, these all things are related with alpha 1 activity. Now we will go with alpha 2 activity. The majority of alpha 2 receptors are present on the preganglionic fiber, preganglionic fibers, presynaptic fibers. Alpha 2 receptors are present on presynaptic nerve endings. The secreted noradrenaline stick to presynaptic nerve ending, produces a negative feedback and further stops the release of noradrenaline from the presynaptic nerve ending. This is the major role of alpha 2. Alpha 2 is also act on pancreas. They are present on the pancreas. Stimulation of alpha 2 on the pancreas inhibits the release of insulin. This is all about alpha 2 activity. Now, dear students, we will talk about beta 1 activity. Beta 1 activity is more concerned with heart rate. It increases the heart rate. It increases the force of contraction of the heart. it also increases AV conduction. Atrioventricular conduction of the impulse also increases by stimulation of beta 1. Beta 1 receptors are present on the juxtaglomerular apparatus of the kidney, of the nephron, which secretes renin. Renin is responsible for conversion of angiotensinogen to angiotensin 1, ultimately to angiotensin 2, and a whole RAS system, renin angiotensin aldosterone system, will activate and will produce high blood pressure. This beta 1 also increases the ADS secretion from the posterior pituitary. Antidiuretic hormone, when gets secreted, it will retain sodium and water. It will increase the sodium and water reabsorption in the proximal tubules and increases the volume of the blood. Ultimately, it will produce hypertension. Beta 1 stimulation is also related with lipolysis. When we use beta 1 stimulation, the fat utilization increases and lipid profile is positively affected. Now, dear student, we will talk about beta 2. Beta 2 stimulation is mainly concerned with bronchodilation. All of you know salbutamol. Salbutamol, terbutaline are selective beta 2 stimulants. They bring about bronchodilation. These beta 2 are also responsible for vasodilation. They bring about the dilation of the peripheral vessels. Beta 2 also bring about smooth muscle relaxations inside the visceral organs. The urinary or the ureters get dilated. The biliary system get dilated. The intestine will relax and also the uterus will relax. We use the drug isosupreme or ritodrine. They are beta 2 stimulants. They bring about the relaxation of the uterus, and these drugs are very helpful in the patients who are having PTL, preterm labor. This beta 2 is also related with conversion of glycogen to glucose. The conversion of glycogen to glucose, BSL, that is blood sugar level, will rise and sugar in the peripheral tissue will increase. Now, the last one is beta 3. Beta 3 are present mostly on the adipose tissue. Stimulation of beta 3 bring about conversion of fats to their metabolites, that is lipolysis is strongly stimulated by stimulation of beta 3. Beta 3 are also present on the bladder. Stimulation of beta 3 relaxes the bladder, and this relaxation of the bladder is helpful in the patient of hyperactive bladder. Hyperactive bladder is a state where the patient has to go repeatedly to urinate. Dear students, this is all about the alpha receptor and the beta receptors. We are having the drugs known as beta blockers. They are subdivided into selective beta 1 blockers and general beta blockers. We are having alpha blockers like prazosin. These drugs are having blocking activity for these receptors and are having exactly opposite actions, which we are discussed now. To summarize the adrenergic receptors, alpha 1 is responsible for vasoconstriction. It is responsible for inhibition of lipolysis. It is responsible for glycogenolysis. It brings about the constriction of the smooth muscles of urethra. It brings about dilation of the pupil, that is mydriasis. It is responsible for inhibition of renin secretion. These are the properties related with alpha 1. Alpha 2 receptors are expressed on the preganglionic fiber, where the secreted neurotransmitter again binds to the alpha 2 receptor. The binding of it reduces the further release of, say, noradrenaline. Then it is also responsible for reduced secretion of insulin. It inhibits the insulin secretion, alpha 2. Now, beta 1 is responsible for increasing the heart rate. It is responsible for increasing the force of contraction of the heart. Beta 1 is responsible for secretion of renin, and the whole RAS system is activated by the stimulation of beta 1. Beta 1 is also responsible for the secretion of ADH, and beta 1 is also responsible for stimulation of lipolysis. Then comes beta 2. Beta 2 is principally related with bronchodilation. It is related with the smooth muscle relaxation of the viscera, the intestinal, the biliary, the urinary, and the uterine muscles are relaxed. It is also responsible for vasodilation, and beta 2 is also responsible for glycogenolysis, means conversion of glycogen into glucose. Then comes beta 3. Beta 3 are majority of them are expressed on the adipose tissue. They bring about lipolysis and are also expressed on the urinary bladder. They relaxes the urinary bladder. This is how, dear students, we have seen alpha 1, alpha 2, beta 1, beta 2 and beta 3. These are the details of adrenergic stimulants. Dear students, I know that you like my videos. Then please share and subscribe. Thank you.